Welcome to the American Academy of Grief Counseling's Videogram on death and dying. And in this particular video, what we're going to look at is the process of dying, philosophies about dying from various religions, and also some psychological concepts regarding the dying process, as well as how healthcare professionals and those in ministry can approach discussion with one who is going to die, or how to calmly and professionally let one know that they don't have much time left, which can be a very difficult conversation, one that many like to avoid. So what is death? Well, there are various qualities for those, especially with coroners who pronounce time of death. And if someone is no longer alive, lack of respiration, no pulse or heartbeat, no response to stimuli, to lowered body temperature and stiffness. A lot of forensic professionals on crime scenes, they're able to diagnose if one is dead or not just by a lot of those physical manifestations of death. The Harvard criteria looks at one to be unreceptive to stimuli, no movements or breathing, no reflexes, no circulation of blood to the brain, and a flat EEG. In religions, the idea of death, especially within most world religions, is that death is a separation of the spirit from the body. So the death is only physical. Now, obviously, those within more atheistic fields, or those who are more in the field of science, only believe in what is verified, logical positivists and so forth, and empiricists, death is final in their view. But for those with spiritual views, death is indeed only physical, and the spirit itself exists after death. In Eastern religions, Hinduism, Buddhism, and so forth, death is seen as a continual process of birth and rebirth, and death is a balance of that. So it's a continual process. In Western religions, though, death is a result of sin, and the body dies, but it will one day resurrect. So in Western traditions, the body is not so much a shell, a temporary shell, but it is a critical component of the human nature with the soul. And it is so important that later it is resurrected, restored, and glorified. So those are some ideas of death that you might come across with those who are more religious. Now, from a dying perspective, one doesn't begin. There are numerous philosophical ideas. Some say the moment of dying starts at birth. Individuals who are born with their first breath have a certain number of breaths that they will take their whole life, and the process begins. And while that's kind of the dark idea, it is, I guess, technically true. But I think we have to go a little bit more where systems start to be less than optimal, would probably be a better definition of when dying begins, when various organs and various systems within the body are not operating to standard to sustain life. In terms of mental, when are the facts recognized by the doctors? I mean, you could be dying and not know it. So when are the facts recognized? When are the facts communicated? And when are the facts realized and accepted, at least within the agent, within the person who is dying? When do they finally accept that as well? And also from a medical standpoint, when it is very much and clearly stated that nothing can be done to stop this acute process of end of life. Nothing that we know scientifically, medically, can prevent what is about to occur. Now, there are trajectories of certainty and time. Some individuals have a lingering trajectory when they're pronounced that they're going to die. It could be a long, Hall type disease, where they're put with cancer, when they're put into palliative care for 6 months, or it could be a rather quick trajectory where an individual is given a couple weeks or so. And of course, there's an unexpected trajectory where it is very sudden and there's not much time really to reflect on the dying process itself. And these are all types of trajectories that doctors have to deal with and healthcare professionals have to deal with when they are delivering the bad news. Now, chaplains, ministers, priests, they all play a key role, but doctors, physicians, and healthcare professionals usually are the ones who give the unpleasant news. And unfortunately, many of them are not trained with good bedside manner. They're not trained to be able to communicate psychologically, emotionally, the information of the dying. In many ways, the healthcare sees it as a win or a loss. Was I able to fix this person? Almost to the point where it becomes a machine. Am I able to fix it? No, I can't fix it. There's nothing I can do. And that language can become rather sterile, uncaring. And when we think of treating a person, we're not just treating the body during the dying process. We're also treating the mind and the emotional state of the individual. And if you're a believer of the afterlife, you're also comforting the soul. You're showing compassion. So I think it's very important, especially in pastoral thanatology, care of the dying process itself, that healthcare professionals learn to be a little bit more sensitive, to give a little bit more time, to treat their patient completely, to treat their patient fully. So there's a few things here to consider if you're in the healthcare field and you deal with death on a consistent basis. You want to take time to communicate. Don't just give the diagnosis and then walk out. Allow the diagnosis to be digested. Share the fact, feel the response. Give time for the response. Don't overload quickly. And when you're explaining, educate, provide options. So many times individual hears something and they don't know what it is. Tell them what it is. Explain how it works if they want. Now, some individuals aren't going to want more information, and that's fine. But give the option for them to know. And never stretch the truth. Allow time for pauses, processing the information. Respect denial. What is one of the first stages in Kubler-Ross? Denial. So individuals are going to say no. There's going to be emotional outburst. So you want to be there and allow the grieving process to take place, to allow it to manifest, and to be there to give a comforting hand as needed to these individuals. So within the process of dying, there are also psychological, mental stages. Kubler-Ross's 5 stages, which is very famous and throughout our curriculum: denial, anger, sadness, bargaining, and acceptance. And they can be in any order, technically. And this really deals more so with the news of the dying, because Kubler-Ross worked with the dying. And the 5 stages was particularly created, not for an overlap of all grief, but more so for one who receives the bad news. Charles Core listed the needs of the dying as physical first, psychological, social, and spiritual needs. And they go through that process of what they need to address as they accept the fact that they're going to die. And then within spirituality, we talked about the Buddhist concepts where a cease of sensation occurs with visions and a transference into nothingness. And in Hinduism, a transference maybe to another existence. And if you're in pastoral care and you're dealing with someone from the East, you're going to want to have some idea of their needs, because the dying process is very, very important and articulate, detailed in regards to what the family has to do, the rituals that have to be performed for their belief system. And of course, in the West, with a lot of the near-death experiences, what we've seen is concepts of light and warmth, or in a more horrific way, dark and cold. So what are they experiencing? What are they seeing? Is it truly a metaphysical experience? Or from a more empiricist view, is it merely chemical reactions within the brain, firing off as death approaches these things? So are they metaphysical, or are they merely natural to the brain? And those are interesting questions for another day, perhaps another video to review. But I think it comes down to ultimately whether you believe in the afterlife or not. But what is the reality? And that's something that can't be proven probably with modern empirical science, and something that we'll all eventually discover. We offer a 4-year grief counseling certification. So it lasts for 4 years after you take the 4 core courses. The courses are online and independent study, and it's open to qualified professionals who want to enter into grief counseling. And we also have a pastoral thanatology program that focuses more on just the aspect of dying, caring for the dying, helping the dying, understanding these concepts in which we've discussed. So you can also check that out. But for now, we have the link to the American Academy of Grief Counseling, which will also lead you to anything that you might have interest with in regards to pastoral thanatology. Our email is info@aihcp.org, and our phone number is 330-652-7776. One of the things that I didn't get to is the importance of remembering that dying is part of life. It's something that we put off, obviously, as long as we can. We don't want to talk about it. We don't want to think about it. It's not morbid to think about it. It's actually rather wise to see how to live life to the fullest. And part of living life to the fullest is experiencing death. And while that seems like an oxymoron or a contradiction, it's very true. So instead of fearing death because of the unknown, how about try to understand it a little bit, be prepared for it for the good of your family and for your own things to be in order. And maybe, and just maybe, you won't have as much of a death anxiety throughout your life, because eventually it will come. But in the meantime, we can be prepared and we can enjoy life as it is. I'd like to thank you for listening, and have a great day.